Hi friends, myself Dr. D. Sunil Reddy. Today I am here to talk about the role of vaccination in patients with heart disease. If you know anybody who is suffering from heart disease, please recommend this video to them so that they know the role of vaccination in patients with heart disease. Each year, thousands of people with heart disease get sick and are hospitalized, and some even die because of aggravation of their heart disease by infections which could be prevented by vaccination. So, if you know anybody who is having a heart disease, please recommend them to consult a doctor so that they know whether they need to get vaccinated or not. Patients with heart disease have a hard time fighting off the infection which could exacerbate their heart disease. Vaccination in this situation plays a major role by helping them develop immune response against those infectious which could aggravate the heart diseases. Vaccination is one of the safest method of protection against these infections in patients with heart diseases even while they were on their prescribed medications. Vaccinations have very minimal or hardly any side effects, and even if they have any side effects, are usually self-resolving. Some vaccine preventable diseases like the influenza or the flu can increase the risk of another heart attack. Among patients with heart disease, vaccination against two infectious agents has shown a consistent increase in survival rates and decreased rate of hospitalizations. The two most important vaccines to be given in patients with heart disease are the influenza vaccine or the flu vaccine, usually recommended once yearly, and the second one is the pneumococcal vaccine, which is usually administered once every 5 years. There is an association between acute respiratory infections and the incidence of heart attacks, especially during the peak season of influenza. Influenzaal infection is commonly associated with exacerbation of heart disease, leading to frequent admission with heart failure. Influenza related death is more common in patients with cardiovascular disease than in any other chronic condition. The type of vaccine given in cardiovascular disease patients is inactivated influenza vaccine. Inactivated influenza vaccine is recommended to all elderly patients above 50 years of age, especially if they have cardiovascular disease like previous history of heart attack, heart failure, diabetic patients, and who have undergone bypass surgery. Although influenza virus is circulating throughout the year, it has got two peak seasons, and during these two peak seasons, people with heart disease have this infection and get admitted with exacerbation of heart failure or heart attack. The peak season of influenza begins in late October and almost lasts till May June. So the best time to get a influenza vaccine is somewhere in the month of October. Although it can be given in any month of the year, but the best results have been seen if patients take in the month of October. Vaccination with influenza has been associated with significant improvement in the quality of life of patients with heart disease, especially by decreasing the rate of hospitalization and decreasing the rate of heart attacks in patients at risk of heart disease. As with influenza, pneumococcal disease is also associated with increased risk of heart failure development. Pneumococcal disease, especially in patients with heart disease, is associated with increased risk of heart attack and increased risk of heart failure development. Pneumococcal disease has been associated with long-term risk in patients with heart disease. Pneumococcal vaccine, which is recommended to be given in older people, is different from that given in children. It is a 23 valent vaccine. Pneumococcal vaccine is recommended in all elderly population, people who are at higher risk of developing heart diseases. It is recommended in people who are diabetics, who have history of heart failure, history of previous heart attacks. As people who smoke have higher risk of developing pneumococcal pneumonia, people who smoke also have to take this vaccine. By taking this vaccine, we can prevent development of new onset or worsening heart failure and onset of heart attacks. So it is recommended that all elderly populations and people who are at risk of developing heart disease do take this vaccine. In summary, I would like to say that all people who are at risk of developing heart disease and or had heart attack or heart failure in the past have to take these two vaccines, pneumococcal vaccine and influenza vaccine. So next time you visit a cardiologist or a physician, do ask for vaccination, its requirement and whether you need it or not. Thank you.